That is class 1 cavity. Now remember, as far as this is, there are two structures here. One is about the exam and one is about exactly what is Engel's classification. So now here for the exam purpose, they have not included lingual pits of maxillary incisors. Okay? For exam purpose, it is only, you can say, pits and fissures of occlusal surfaces of molars and premolars. That is only for exam. But in general, it includes the lingual pits of maxillary incisor. For exam purpose, it's only molars and premolars. Okay, so don't tell me that why you gave me wrong, I have written the correct. Because there is a key is for exam is like this. It does not include lingual pits of maxillary incisors. Now one thing I am going to explain you on the board. Okay, so that I leave it. Now page 439. Clinical examination of the patient. Whole paragraph. Okay, so what it says about the clinical examination for dental assistant, what is your duty?
You will follow the routine protocols for this procedure.
You escort the patient to the clinical area.
Take out the important points.
Escort the patient to the area for examination. You follow the routine protocol. And you seat the patient and give them.
So important thing is that you have to go, there is a known as route sheet, okay, what the patient information is always there in that one. When before you talk to patient, there is a, you have to take out, print out from the computer, there is a route sheet about the patient's names and age and date and appointment time and what is to be done. That is in your hand. You take it to the reception area, greet the patient, call the patient, and escort the patient from the reception area to the operator. It may be from there to here, or maybe even longer, depends upon the dental office, a pig, maybe a left and right and left and right. So you have to go there, you have to greet the patient, you have to confirm with the reading the patient's name, and when patient says it is me, sometimes you have to ask with the birth date also, confirm, because sometimes the two patients same name, so you have to confirm. And then keep talking, bring the patient to the dental chair, ask the patient to sit on a dental chair, not in a supine position but upright position, and then you put the word is either napkin, bib, or what is the third word? It's not written. Any third word is there? No. What you put it here is known as bib and napkin. Any other word we use it? No. Any extra word for what you are putting? Napkin, bib, any other word we can use it? Okay, because I have heard some of the patients when we say, okay ma'am, let me put the napkin, so they say, don't say napkin, it is not good word. Some you say that I am putting the bib, say, don't say that, this is for the children. Okay, so is there any other good word?
No. Clothes cover. I don't know.
What?
Say clothes cover.
I don't know, I'm asking you.
Can't think of
Because
anything
both
else.
the words I have heard in one dental office, that they have what they don't tell them. Okay. So that's the important thing, that you have to escort. Okay. After putting this one, you have to inform the patient what treatment is about to be done today. You have to explain the patient in detail the procedure. Okay. After explaining the procedure, you have to ask the patient, do you have any question regarding this, what I have said to you? If the patient say yes, you can ask the question and you have to reply. After everything is done, then you have to go to doctor. He is your guest. You have to bring him to the operator. He is not there always. So it means that when the dentist comes, he knows that everything has been explained. Okay, so he will start work immediately. But if you have not done all these things, you have not told the patient about the procedures, you have not asked the questions, then the dentist will start, wait, what you are going to do? So then he will get that you have not finished your job. So that's the most important thing. Okay. Next is soft tissue examination, first 3 lines. Because you have 2 or 3 left. Soft tissue examination, first 3 lines. Okay, there are many structures you are supposed to examine, or the dentist is going to examine. What are they? Okay, so there are many structures. Okay, all this the dentist is going to examine, or sometime he may tell you, not 100%. Then page 443. Procedure number 9.
Bless you.
So what is that part? Which part is being examined in this one? Neck. Either it be on the lower side of the right side or the left side. For what purpose? To find out the lymph nodes enlargement. If there is an infection in that or not. Or that is painful or not. Okay, that's the soft tissue examination. That can be sometime done by dental assistant. No, the dentist will do, but sometimes he may ask you to do that. What? No, I have no idea about that one. We have to see on the, because there are many expanded functions are there. Some they allow, some they don't allow. So there are, you can say about 40 expanded functions are there. So we have to check it out there. But finally, sometimes it is like this. It is prerogative of dentist. If he says to you, you have to do that. If he says no, then you cannot. Okay. Page 448, level 1, emergency care. Level 1, emergency care. Okay, what is level 1 emergency care? In other words, it's a chief complaint of a patient. When patient comes in pain, particular tooth or particular area. Okay. So dentist has to look that treatment first in compared to all other treatment, so that the pain can be relieved, patient will feel comfortable. Emergency care does not mean that patient came with a fractured jaw or broken tooth. Okay, that is not meaning here. It is meaning here why the patient has come. Okay, so that is important, that patient has come for particular pain in particular tooth, and that is to be treated first. That is known as level 1, and that is known as emergency care. Page 449, class 2 mobility. Okay, what is class 2 mobility? So important thing you have to remember is it is mobility is more than 1 millimeter in any direction, but not depressible in the socket. Okay, page 437. 437. The chart C. Chart C. On the upper side, on the left and right, number 7 is there. You highlight that part. Number 7 on the top, where the B is written, number 7 on left and right.
Our B is written.
Not this one, left and right. This is left and right. This is upper one. Okay.
Palmer's notation, said.
I think this is for the Exactly, so.
Okay, so that's enough for all your highlight. Please come on the board, I'll explain you this system. Then you can work on your paper only, not on board or on your, then you have to practice on your the paper I have provided today, which is better in show, and you can easily find out your treatment.
How come you guys haven't used the Palmer's notation? Because he said it was going to be on the exam. Where is it? Palmer's notation? The maxillary. Okay. Jot that down.
Okay, so Palmer notation system are not used in United States. First thing, what we use it? Universal or national numbering system that we use here. This used in many countries like Palmer notation system. Like if you say in Asia, they don't use this universal. They use Palmer notation system. So in this one, it's the same. Left and right is the same. Left and right is the same because that cannot change. Means your right side is patient's left side and your left side is patient's right side. Okay? But here tooth are numbered from 1 to 8. Okay? So if I take this here,